Fox 56 News Chief Medical Contributor Dr. Ryan Stanton back with us again in studio.
And this time, this segment, he's focusing on a recent spike in COVID cases.
Yeah, we are seeing another increase, and like right after the last segment you mentioned, I completely forgot, we got Klaus back there. We needed to have the COVID outfit reappear again. So if this continues, Klaus, be ready.
Klaus says we didn't need that.
Yeah, well, that happens. That's why I don't have an IFB. So I've seen a significant increase in COVID presentations in my ER shifts this last week, including my first 3 admission shift for COVID patients in the last couple of years. This local experience reflects a broader national trend. According to the CDC, as of late August 2025, COVID-19 infections are rising in more than 30 states. Several indicators are moving upward, including test positivity, emergency department visits for COVID, and new hospital admissions have increased as well. The surge is being driven by the highly transmissible Omicron subvariants. The group most impacted remain older adults, individuals with underlying health conditions, residents of long-term care facilities, and people with chronic lung disease or prior infection damage. A recent CDC report highlighted that older adults and infants experienced more COVID-19 hospitalizations than influenza during the past respiratory season, underscoring the ongoing risk of this virus. While the current wave is not as severe as earlier pandemic peaks, tracking the virus is more challenging as many cases go underreported due to at-home testing and symptoms which mimic other viral syndromes. Though there have been many questions and restrictions placed on vaccines by policymakers in Washington, D.C., the vaccine is still a safe opportunity, especially for those at higher risk of severe infections, complications, and death. So, I mean, the biggest thing right now, actually, the COVID and the COVID vaccine is the #1 search for health-related in the U.S. as of yesterday. And that's important to understand that when you see those trends, that's when you start to see the fact that it's impacting people wherever we are across the country. So that's a big deal, getting some clarification there. But the vaccine is going to be available. The newer one has been approved. It's still limited, but keep an eye out for it, especially if you're higher risk.
This is interesting to me because I feel like a lot of times when it comes to vaccines, we think, oh, when fall gets closer, you know, for the flu shot and things like that. Not necessarily the case, though, when it comes to COVID.
You know, with COVID, you got to be aware that it hasn't seasoned yet in terms of what we see with influenza. It tends to be these spikes as it gets the opportunity to go. So be aware of that. It's out there right now. The numbers are picking up. Just be safe. Take care of each other.
All right, Doc, thanks so much. We
Thank you.
appreciate having you here as always.
Appreciate it.
Our 8 o'clock hour is on the way. Don't go anywhere.
You're watching Fox 56 News. Our home, your news.